Thank you guys for coming for this session. This is Shivani Nazareth, and she's going to share a little bit about carrier screening in her organization.
Yes, thank you.
Shivani.
So Brad tells me there was a choice between listening to me or having brownies. So thank you for choosing me. So just a little bit about me. I am a genetic counselor, and I serve as the Director of Women's Health at Council. And before joining Council, which I'll get to in a minute, I was a genetic counselor for a little over 10 years, and I worked in New York City in the fields of prenatal genetics, pediatric genetics, and cancer genetics. And what struck me over the course of my career was seeing people after a diagnosis, or for instance, after a cancer diagnosis, or after a child had been diagnosed with a disease where if the parents had known maybe even just 2 years earlier, they could have started treatment. So I've become really interested in getting information to people earlier. And in particular, I believe very strongly in preconception carrier screening for people that want the information, that we should have access to this information before we even start a family. So I'm going to talk a little bit about the changing trends in carrier screening. So on the left here is a picture of Ezra. He is a little boy who was diagnosed with SMA, spinal muscular atrophy. And he was diagnosed at 4 months of age, and then I believe he passed away at about 9 months of age. And like many of the people who are all too familiar with this, his parents sort of went from doctor to doctor trying to figure out what was wrong. And I'm in touch with his parents, and one thing that they sort of, keep talking about is they were that couple that thought they did everything they were supposed to do. They went to the doctor beforehand, they asked what screening they should be doing. They were offered screening for cystic fibrosis and like a handful of other conditions because they were a little pushier than most, but they still didn't get screening for SMA. And I always go back to this quote from Francis Collins that in a few decades we'll look back with this sort of sense of disbelief that we offered couples so little before they actually started their families. So the fact is, and we've heard a lot about sequencing today, we can sequence for many different rare diseases, and we can do this at a very low price point, and that makes it much more accessible. So when I think back to when I was pregnant with my twins, that was 7 years ago. You could test for individual genes, and it was about $800 to $1,000 to test for those individual genes, and that was 7 years ago. Fast forward 3 years later, you could test for over 100 genes for the cost of just testing for one gene. And I usually say, for any couple that decides that they want to learn about cystic fibrosis, they're going to use that same rationale to want to learn about other rare genetic diseases, or perhaps knowing in advance can make a difference in the outcome of their pregnancy. So we've actually screened nearly 500,000 patients to date with these large panels of over 100 disease genes. And what we're finding is that kind of some of the theme is coming out in this conference that individually diseases are rare, but collectively they're more common. So if you start screening people using panels, you'll actually find that about 1 in 25 people are a carrier of something. And that sort of gets the conversation started. You find carriers, you start to sort of just make it a normal part of preconception care. And I would argue that right now, the status quo is you find out you're a carrier because you have a child with a genetic disease, and that's not the ideal way to find out that you're a carrier. So I would love to talk more about the research findings, but in the interest of time, I'm just going to skip ahead. So the American College of Medical Genetics actually strongly believes in preconception genetic screening. And they compare it to newborn screening in that they say that the earlier families know, the more time they have to prepare and the less time they spend on this diagnostic odyssey, which is, going from specialist to specialist trying to figure out what's wrong. Pictured here is Emily Rapp. Is anyone familiar with her? So she is a woman who is not Jewish, but had a child with Tay-Sachs disease who passed away about a year ago. And she writes, she's a writer, so she writes very poignantly about it. But one of the things that she kind of says is that she was one of those people. She asked her doctor, she asked her genetic counselor for screening, and she was told, oh, don't worry about it. Literally told, you don't look Jewish. And like that stuff just gets my blood boiling, because in today's age where screening is so accessible and so affordable, we shouldn't have such strict exclusionary criteria around who should have access to screening. So the question that I pose, and what I've sort of dedicated my career to at Council, is how do we raise awareness of preconception carrier screening? How do we get doctors to talk about it? And to be clear, I'm not suggesting that everybody should be screened, because I understand that it's a really personal decision, and some people just don't want the information. But what I really strongly advocate is that everyone should know that it's an option. So everybody should know that carrier screening is something they can do before they have a family, and then they can decide for themselves as a couple how they want to use the information. And everyone's going to use it differently. But if it's never offered to you, then essentially that choice is taken away from you. And again, it sort of gets my blood boiling, and it's what gets me up in the morning. So I really want all women, if you look at checklists like on Baby Center, and you look at these checklists of all these things that women should be doing, it's things like go to the dentist and plan your baby moon because you're not going to have time after the baby's born. Stop drinking alcohol. I mean, all of those are important, but carrier screening rarely ever makes the list, and I really want to change that. So I'm going to switch gears and talk a little bit about Council. I think it was Matt who said that the companies that come out of Silicon Valley, their sort of goal is to break the status quo. And Council is actually a company born out of Silicon Valley. And our goal is to make carrier screening as easy as possible, accessible, affordable, and to have each of the results associated with genetic counseling. So every result, a patient can actually call and talk to one of our genetic counselors within 5 minutes. So I love this because this means that anybody that really wants to have carrier screening can have it. So if you're a patient, you go to council.com, you click on Order Now, you fill in your information, you fill in your doctor's information. We on the back end will then contact your doctor, get the order approved, and we will send you that box, that saliva kit, to your home address. Once we get the sample back from you, it comes with a prepaid envelope, we then send you the results via a secure portal, and we ask you to schedule a genetic counseling appointment. And in between the time when you get your results and talk to a genetic counselor, we have educational videos that are specific to your findings. So you might click through all the educational videos and decide, I understand this, I don't need to talk to a genetic counselor, or I want more information, who can I talk to? Did you have a question? We do, and I actually have flyers and, oh, she wants to know what diseases we test for. We have flyers, I'll give them to you. And we're actually planning to increase the number of diseases, but right now it's a little over 100. So far, like I said, we've screened almost 500,000 patients. We've done over 10,000 hours of genetic counseling. And And what we're finding is that people really like to have access to this information from the comfort of their own homes. It makes it a lot easier. Some people do go into the doctor. We have doctors that draw blood and do this, but there are people that sort of live in areas where maybe they don't have access to this, and it just makes it really easy for them to get screened if they want the information. So I just end with a quote here about precision medicine, because there's a lot of talk about genomics being the future, and I feel pretty strongly that, you know, this is a tool that we have now that we can put into practice now, and it's just a matter of people being aware. And the other thing I would add is it's only going to get less and less expensive over time, which means that we'll be able to screen for even more and more diseases. And that's a tool that I think everyone should have access to. So with that, I will end. I know this is kind of a short session, so I have my email in case people have questions that I don't get to today. Yes?
You said you have about 100. If the woman wants also for the rare genetic diseases in her family, it's probably not 100. Can they specify? Are you able to test for anything?
Oh, well, technically we can, but then because we're a CLIA lab, we can't. So no, we can't test for anything because we have to be compliant with regulations. So we could probably do something like on a research basis, but on the whole, we will just test for the diseases that are on our panel.
Was that you specifically asking about?
Yeah. Yeah. Yes.
I have two questions. So you were saying that it cost about between $800 and $1,000
It did.
5 years ago. Is that what it cost now?
No, so to test for over 100 diseases, it's $349, and that's if you pay, you know, out of pocket. Most of the time, we can get it covered by insurance.
And then the other question is, I have the first disease. How hard is it to add a disease or
So we have a team of scientists that's continually looking at mutations and diseases that we could potentially add. We're planning to refresh the panel pretty soon, and there will be more diseases on it. But a lot of times it comes down to, can we do it in a scalable way and in a repeatable way and make sure that results are accurate and valid, and all of that takes time.
We're going to have to, I'm sorry, please take down Shivani's email because I know you've made yourself available to questions with everybody.
Thank you.
I wanna